occupational health and safety practices of the service crew on board domestic passenger vessel in Batangas City.
This is the title of our chosen study, and this study covers the school year 2021 to 2022. Workplace is one of the most important places that has an impact on employees' physical, emotional, economic, and social well-being, as well as their families, communities, and society's overall health. A health-promoting workplace can result in positive changes that boost an organization's overall performance. So, let's talk about the OHS, or the Occupational Health and Safety, as the main variable of our study. Occupational health and safety is the multidisciplinary practice dealing with all aspects of health and safety in the workplace, with a strong focus on preventing workplace hazard. Global occupational health and safety also become local in development countries due to many factors including untrained migrants, workers in informal sectors, constructions, and agriculture. The service crew on passenger ships is a vital part of the entire customer's experience, but they also play a key role in a safety organization in an event of an emergency. In the Philippines, workers and employees are promoted and protected by Republic Act 11058, or an act strengthening compliance with occupational safety and health standards and providing penalties for violators. Therefore, the Occupational Health and Safety Law provides that each Filipino worker is protected against injuries, sickness, or death through safe and healthful working condition.
Background of the study. According to Osterman and Hart of 2016, the service crew are one of the vital elements of a passenger vessel in maintaining safety on board and prevents hazardous incidents and injuries among passengers. But crew's well-being and working conditions is as important as anyone on board the vessel. In addition, of Robin Correll 2021, healthy and safe workplaces are often taken for granted in the US, says Robin Correll. Safety-conscious factories and offices are modern inventions, the direct result of occupational health and safety professionals' efforts. Occupational health and safety is a public health field that studies trends in worker accidents and diseases and recommends and executes prevention measures and laws. In Hart 2016, he stated that due to the lack of committed national agency to manage all OHS projects across all industries and sectors, certain agencies' OHS mandates are unclear. Stakeholders' roles and responsibility are unclear. Government agency coordination is lacking, and OHS regulations are not being enforced. It is vital to bridge these gaps in order to ensure that the policies are executed successfully and efficiently.
Statement of the problem. The main objective of this study is to assess the occupational health and safety practices of the service crew on board domestic passenger vessel in Batangas City. Specifically, the study intends to address the following. SOP 1. What is the demographic profile of the respondents in terms of age, sex, job position, civil status, employment status, number of years in company, and educational attainment? SOP 2. What is the level of frequency that measured occupational health and safety practices in terms of physical condition, organizational, and social working condition? SOP 3. Is there significant differences between the respondents' assessment and the above-mentioned variables when grouped according to profile variables? SOP 4. Based on the findings, what recommendation may be proposed to improve the occupational health and safety practices of the service crew on board domestic passenger vessel in Batangas City?
Theoretical framework. From the days of searching and finding what's the best for our study, we came out to choose the occupational safety and health of the service crew on passenger ships of 2020 by Cecilia Osterman, Carl Holt, and Gesa Pretorius. This jury is divided in three sub-variables, namely physical condition, organizational, and social working condition. We all know this jury and sub-variables will definitely assist us in determining how important the occupational health and safety practices of the service crew on board domestic passenger vessel in Batangas City. Conceptual framework. For our study, we use the IPO model or the Input Process Output model. The input contains the SOP1 and SOP2, which is the SOP1 is the demographic profile of the respondents in terms of age, sex, job position, civil status, employment status, number of years in the company, and educational attainment. And the SOP number 2 is the level of frequency that measure the occupational health and safety practices in terms of physical condition, organizational, and social working condition. For the process, it consists the descriptive method and analysis of data through survey questionnaire. For the last, which is the output, it covers the SOP number 4. It is the recommendation may be proposed to improve the occupational health and safety practices of the service crew on board domestic passenger vessel in Batangas City.
Significance of the study. The study aims to determine the impact of the occupational health and safety practices of the service crew on board domestic passenger vessel in Batangas City. Service crew, cruise ship company, cruise ship industry or maritime industry, Lemery College's research library, researchers, and future researchers.
Scope and limitation or the coverage and limits of our study. This study covered the school year 2021 to 2022. The respondents of our study are the service crew in a domestic passenger vessel. We believe that these respondents will surely help us by answering some questions regarding to our study. The researchers covered the profile of the respondents. It will cover the profile of respondents in terms of age, sex, job position, civil status, employment status, number of years in company, and educational attainment. The respondents will be chosen purposely since the device questionnaire can only be answered by the service crew of the passenger vessel. Ethical considerations will be observed all throughout the conduct of the study. Definition of terms. For better understanding of the context of this study, the following terms were defined operationally and conceptually. Occupational health and safety. It is a multidisciplinary field concerned with the safety, health, and welfare of the people at work by Fowler of 2018. While the operational meaning of occupational health and safety, it refers to the promotion of health and safety protection and prevention of accidents, injuries, diseases, or deaths that occur during the employment of ship crew on board by following mandatory ship rules and regulations and standards by Osterman of 2020. For organizational, it refers to the condition between the organizational and the employee while on board by the freedictionary.com of 2014. For the operational meaning, the service crew on board passenger ships are considerably less likely to agree on the positive statements in the survey on how work organized within their own department by Osterman of 2020. Physical condition. The condition and state of the body or bodily function by the freedictionary.com of 2014. For the operational meaning, a physical work environment can be categorized as factors associated with high physical workload, workplace design and practices for employee participation when redesigning work environments or purchasing tools or equipment by Osterman of 2020. Social working condition refers to the working environment and aspects of an employee's terms and condition of employment by Eurofound.europa.au of 2012. For operational meaning, the social work environment factors that were identified largely concern the interaction between college and managers and the professional meeting by Osterman of 2020. Service crew. Service crew are individuals that serve customer directly in a business organization by service job description of 2022. For the operational meaning, the service crew refers to the service crew on board a passenger vessel which is a vital part of the customer experience and has important duties in the safety organization by Osterman of 2020. Passenger vessel. A passenger ship is a merchant ship whose primary function is to carry passenger on the sea by definition.net of 2014. For the operational meaning, it is intended to analyze the self-reported health status of the ship crew on board, as well as the most important components of their working environment, among other things, by Osterman of 2020.
The synthesis or the summarization of review-related literature of our Chapter 2. The information or data are gathered within the books, articles, claims that are related to our studies. According to our synthesis, we came up to some claims that can help us to answer the question for our study. According to Antonio, occupational safety and health is defined as the science of anticipating, identifying, evaluating, and managing risks or hazards that may affect workers' health and well-being in and out of the workplace. For Alexander Radic, occupational health and safety is a public health field that studies trends in workers' accidents and disease and recommends and executes preventions, measures, and law. This scope is broad, stretching from toxicity, disease, to aesthetics and violence preventions. Additional information added by Binghai, OHS is a basic human right that applies both locally and globally. Occupational health and safety is a core of human right, universally recognized by the international and local communities and embodied in fundamental policies pronouncements. According to Gluckman, mental health is an important component of physical well-being when it comes to the ships and work on board. We are not only talking about single isolated person's well-being, positive thoughts, and good mood, but also at times the ship's overall safety. However, researchers encounter some problems upon searching and gathering information and articles for the study according to Gapas and Proteus. A lack of sufficient financial and personal resources has limited the ability to sustain these achievements. When studying variables within the social work environment, a lack of identity and acknowledgement as seafarers was identified as a major contributing factor. Although passenger ships have most people, other crew members may not consider the staff to be sailors. Now, our curiosity came up with this study. We want to know why the service crew on board are not to be called as seafarers. We all know that most of the seafarers on board are sacrificing not only their time, but their whole life as well. And the next problem is, why do such as local agencies and government lacking their attention to the occupational health and safety? We want to conduct and analyze this study for every service crew on board for them to have a background or knowledge about their own rights in OHS.
Chapter 3, Research Local. This discusses the place or setting of the study. It describes in brief the place where the study is conducted. The first passenger vessel is located in Batangas City on Rizal Avenue, P. Dandan Street. The other passenger vessel is located on Terminal 3 of Batangas Port, Santa Clara, Batangas City. We choose these two passenger ships as the finest source of information and prospective suggestion for their study since they need to maintain the track of the service crew's health and safety, believing the shipping lines to be the best and most prestigious in the region. Research design. Descriptive method, quantitative research design. The process of collecting and interpreting numerical data is referred to the quantitative research. In order to determine the occupational health and safety practices of the service staff on board domestic passenger vessel, the researcher will use the quantitative research design. The researcher will collect the data using survey questionnaires which will be validated by the panelists and the industry expert. Respondents of the study. Ethical consideration when giving out the letter to survey minimal health protocol observed. The researcher will conduct a survey among the two passenger vessels of selected shipping lines. There are 55 service crew in the vessel 1 and 44 service crew in the vessel 2. With the combined population of the two vessels, a total population of 99 will compose the respondents for the study. They will be identified based on their age, then gender, job position, civil status, employment status, number of years in the company, and educational attainment.
Sampling design. We will use two sampling design for the research paper, namely snowball sampling and purposive sampling. The snowball or chain repairer sampling design is defined as a non-probability sampling technique in which the sample have traits that are rare to find. This is sampling technique in which existing subjects provides referral to recruit samples required for a research study. On the other hand, purposive sampling, also known as judgmental, selective, or subjective sampling, is a form of non-probability sampling in which researchers rely on their own judgment when choosing members of the population to participate in their surveys. Data gathering. The data gathering instrument to be used for this study are self-constructed survey questionnaire, observation, and interviews to validate the findings of this study. Construction of questionnaire. The first part of the questionnaires contains the demographic profile of the respondents in terms of age, sex, job position, civil status, employment status, number of years in company, and educational attainment. The second part contained the level of frequency that measured the occupational health and safety practices of the service crew on board in terms of physical condition, organizational condition, and social working condition. Each of the variables contains 10 sets of indicators. The researchers drafted this self-constructed questionnaire through the help and the guidance of their thesis advisor. The construction of organized surveys ensures the unwavering quality of question and answer from the respondents.
Independent sample t-test. This will be determined if there is a significant difference on physical, organizational, and social working condition when grouped according to age, sex, job position, civil status, employment status, number of years in company, and educational attainment, which were stated in statement of the problem number 3 of chapter 1. Analysis of variance. This will be determined if there is a significant difference on physical, organizational, and social working condition when grouped according to age, sex, job position, civil status, employment status, number of years in company, and educational attainment when were stated in the statement of the problem number 3 in chapter 1.